Good afternoon, everybody. Am I audible?
Yes, ma'am.
Myself, Dr. Aroy Pandey. I welcome you all on behalf of Arihant Homeopathic Medical College, respected dignitaries of our college, respected Dr. Juhi ma'am, and respected principal ma'am. I welcome you all. So without uh, the topic of today's webinar, that is research prospective in homeopathy. So first of all, because there is the ma'am to us there is something that about research we are not that much aware. So the ma'am will focus on this. The topic of today, that is the research for prospective homeopathy. So let me introduce to our speaker, Dr. Juhi Gupta ma'am. She is a well-known teacher in the Government Homeopathic Medical College, Bhopal, having the experience of more than 20 years. And she is also teaching the research methodology to the PG students. She is also a member of governing body of National Institute of Homeopathy, Kolkata. She is a member of advisory committee of Prasar Bharati Doordarshan. She is the ex-member of the board of the CCRH. She has presented more than 55 papers in national and international seminars and more than 27 papers published in national and international journals. She has received many national and international felicitations and awards of the best excellence in the service. And even she has presented papers and won the best poster award in the Liga Brazil in 2015. She has government of Bhopal has given her the Corona Warrior Samman. She was appointed as an expert in UPSC UPSC exams, and she was also appointed as an expert in GPSC. She is the member of the task force. So was also appointed as an expert by in the AIMS. So so much achievements that if I will go on speaking, the time of the CME the webinar will pass away. So I request all of you to keep your mic on the mute, and if you have any question, just write down in the chat box. At the end of the webinar, ma'am will answer your questions. So without wasting the time, I would request ma'am to begin the seminar. Please, ma'am.
Thank you, Dr. Arohi. At the onset, my voice is clear?
Yes, ma'am. Absolutely.
Okay. So at the onset, I'm very thankful to your institution, particularly Dr. Amita Peter Madam, who has been our teacher. And we are very thankful to you for, identifying me as a speaker for your students and faculty. Now, as you said, Arohi, research is a field which is indirectly addressed in homeopathy. Matlab, so let me ask you, should I speak in English or in Hindi or mixed? कैसा चाहते हैं आप लोग?
You can go for the mix, Dr. Juhi.
Okay, ma'am. So, what I meant is that every homeopath is a researcher, but we fail to realize it. The reason is that there is a gap, and the gap is that the current understanding, analysis, and application of research is not known to the homeopathic student. Actually, what I feel is that we all should be introduced to it at our graduation level, and then we all should be taught how to bring things more into action. Fortunately, we have this subject in post graduation, and so all the students who are doing PG will be studying research methodology and biostatistics. Now, why is research important? क्यों रिसर्च करना जरूरी है, या जो भी आपने किया है उसको रिसर्च के फॉर्म में ट्रांसलेट करना, उसकी अपीयरेंस एक रिसर्च फॉर्मेट में लेके आना, ये क्यों जरूरी है? क्योंकि it has been decided, or it has been well known, that everything which will be documented in the manner of research will be considered as medical literature or scientific literature, or will be tested for its authenticity and replication, etc. जैसे मैं आपको एक एग्जांपल देती हूँ. Last year we did a study on 300 patients of COVID-19 in a multi-speciality hospital of Bhopal. Basically, it is a very well-equipped private hospital, but for COVID, the government had taken it up. Government had taken it under its charge. So, Government of India and our college, we had a communication, and we said that we want to do something for COVID patients in homeopathy. They said, go ahead with it. Do you identify any colleges or hospitals which will permit you? We said, we are already a COVID care center, but we have asymptomatic patients. So the DG said that, can you think of mild, moderate and severe patients? We said, why not? That was a first experience for me also. We went ahead, we went to the government of Madhya Pradesh, and the health department principal secretary was very, very cooperative. We told him that we want to do this. He said, okay, as far as there is no harm, go ahead. And we conducted this 7-month study on 300 patients of COVID, which had hospitalized cases, mild, moderate, and severe. And because COVID is an epidemic disease, it is a notifiable disease now. It is a disease in which a single negligence can lead to mass involvement. So we divided the two groups into standard care and standard care plus homeopathy. Initially, we thought we should have an independently homeopathic group, but then we were explained that since there is no evidence, there is no literature, we should go for this kind of a study and it will give very good results. The same happened. We conducted the study and our outcomes were astonishing, because the people who were in that allopathic hospital, the pulmonologist, the consultants, the head of the department medicine, they were surprised to see that the disease, which is purely symptomatic in nature, is being dealt with so well with homeopathy. And very soon we could give results and findings. So the important thing which is to be taken home, to be understood, is that we all need to do that first step, to take that first step. And this courage to be a researcher is the biggest thing which is required for a homeopath. In my talk, I have very few slides, but I have desire to give you a lot of input. And so I want you all to please concentrate on what I'm saying. Again, what I want you to realize is that homeopathy itself is a very, very evidence-based science. How I say this and why I say this, I will bring to you in my presentation. Now, on my screen, you can see, that's all, yeah. On my screen, you can see that I am requesting you all to join your hands in the same manner, to come together, because we all are new to research and we all have to go a long way in research. If you miss out something in this lecture, or if you want to listen to this lecture again, you are requested to please visit my YouTube channel, where I upload all my talks, all the webinars which I give, all the lectures which I present, I upload all. So at the onset, let me introduce the topic to you, which is research prospectives in homeopathy. So prospective means what you see tomorrow. How do you see research tomorrow? How do you visualize it tomorrow? So first thing to have a prospective vision of something is to know it as it is. जैसी होम्योपैथी आज है, जैसी होम्योपैथी पैदा हुई, जैसी वो बढ़ी, और आज वो जिस स्वरूप में है उसको जानना, बहुत जरूरी है इस चीज के लिए कि कल हम उसको कैसा देख रहे हैं, या कल हम उसको रिसर्च के माध्यम से, शोध के माध्यम से कितना समझा सकते हैं. On my screen, you can see the first point is the age of homeopathy. So homeopathy is a very young medical science, only 230 years or so, and just a few generations of homeopaths have been there. So is it not very important for us to know all the status of medical science and evolution which existed before the birth of homeopathy? Or we should also say, which led to the birth of homeopathy. So to know how homeopathy evolved, we should first know what was the understanding of human body, medical science, treatment, its pros and cons, its flaws which led to the birth of new systems. And every day new systems are coming up and they are quite empowered. Let me give you an example of physiotherapy. It is a simple therapeutic measure. It is not medicine. They are not considered to be doctors. But physiotherapy has occupied a major part of medical practice now. Do you know why? Because the gap was felt. Something was missing on that side. So understand, 230 years back, an allopathic super specialist, Dr. Christian Samuel Frederick Hahnemann, who was a multifaceted personality, had a lot of knowledge of basic sciences, used to read a lot, and had a very good perception. He understood that there was something which was missing. And so he designed, created a new system of medicine, which was homeopathy. But there is something which is very important, which every homeopathic physician should definitely know, and every person related to medical profession should know. That medical practice has got a very large regional factor. मतलब जहां पर उस मेडिकल साइंस को यूज किया जा रहा है वहां की लोकल, रीजनल, सोशल प्रैक्टिसेस, अंडरस्टैंडिंग, फूड, टेम्परेचर, क्लाइमेट, geography, availability, tough conditions, they should be very well known. Let me give you an example. I went to Rajasthan and I saw a lady with some red rashes on her skin. I thought she must be in pain and she is having some problem. I asked her, what is this? ये क्या हुआ है आपके हाथ में? उसने बोला मुझे घाम हुआ है. मैंने उसको बोला आपने घाम के लिए कोई दवा ली, कुछ लगाया? उसने कहा घाम तो यहाँ होता ही रहता है क्योंकि हम तो राजस्थान में रहते हैं और राजस्थान में तो इतना पसीना आता है, इतनी सूखी हवाएं चलती हैं कि घाम होना बड़ी आम बात है, खुद आता है, खुद चला जाता है. यदि वो घाम, वो अर्टिकेरिया लाइक कंडीशन आप में से किसी को, हमको भोपाल में हुई होती तो हम बहुत अनईजी हो गए होते और हम उसका ट्रीटमेंट करते. यू नो व्हाई? Because the people of that environment have adjusted themselves to that particular condition, or we can say it has become a part of their living. So Dr. Hahnemann also said, and every genius of the world has said, that medical science can be born anywhere, but it should be practiced and analyzed in coherence with the local beliefs, requirements, availabilities. Understand that homeopathy is only 230 and you need to have a very thorough knowledge of medical science before that. In fact, in post-graduation, we have a topic which is called History of Medicine, History of Biomedicine. It should be taken up very seriously, and I would suggest that undergraduate students should also read it. So let me give you an example of Ayurveda. Ayurveda was the first system of medical practice in the world, and it was considered to be the system of every person. It was a way of living. And definitely Ayurveda has given birth to every medical system of the world. Till around 2500 years after the birth of Ayurveda, there was no medical system in the world. When Greeks came up, Hippocrates, Plato, they came up in Greece. So Greek civilization came almost 2500 years after the birth of Ayurveda. And Ayurveda has got a very systematic division of specializations in medical science, pediatrics, geriatrics, preventive medicine, all these are already present there. I'm a teacher of physiology in graduation, so I read some very good literature on physiology in Ayurveda, and I was surprised. They have everything, they have mentioned tissues. So please update your information about everything that happened before the birth of homeopathy. What was the gap which led to the birth of homeopathy? To what extent are we able to address the gap? Because every medical system will have its own limitations. Everywhere we cannot fit, nobody can fit. So what are the missing tiles, the gaps, where we have to give place to homeopathy and where we should not be failing? The birth and evolution, we all know. Dr. Hanneman was translating a book, and evolution of homeopathy is an unstoppable process. And that is why homeopathy is a science totally dedicated to research. The birth was a research, a translation led to a discovery. Every single step which Dr. Hanneman must have taken. Imagine, he was translating a book, he read something. He potentized, how he thought of potentizing. What was he reading? What was the thing that inspired him to use alcohol as a medium? What inspired him to use it for a similar condition? And everything in homeopathy was known earlier, maybe in a different form. Likes cure likes was known. The principles of healing were known. Administration of different things in acute and chronic presentations were known. But nobody knew the preparation of homeopathic medicine, which was unique. Nobody knew the drug dynamization or potentization. And nobody defined the principle of chronic diseases in this manner. It was defined in another manner. So these were the major researches done by the genius father of homeopathy and his friends together. And imagine the work which they put together. If any of you has read the lesser writings of Dr. Hanneman, you will realize how he moved step by step. He was a researcher. And any medical practice is not only a science, it is an art. Cooking is not only a science, it is an art. Dressing up yourself is a science and art. You cannot wear synthetic or silken clothes in warm areas. You have to wear cotton. Why? This is a science. And how you present yourself, this is an art. So you cannot, nobody can get over art and science. कोई सिस्टम ऐसा नहीं है जो आर्ट को छोड़ दे, साइंस को छोड़ दे. एलोपैथी के भी लाखों डॉक्टर्स हैं. कोविड हुआ, कितने डॉक्टर्स का क्या रिएक्शन था? You must have heard Dr. K.K. Agrawal. He was so thorough and so simple. Such a fantastic approach. There are people who take serious cases or severe cases, even septic cases in COVID. We have seen the cases in the hospital ward. Doctors used to take it so easily, and there were doctors who would send the patient away. No, we are not taking this patient. अब आपका मरीज सीरियस हो गया, हमारे अस्पताल में इलाज नहीं होगा, इसको वहां ले जाइए, वेंटिलेटर लगेगा. So never forget that every medical science has the same situation which homeopathy has. अगर आपके शहर में 1 लाख एलोपैथिक डॉक्टर्स हैं, आपको उनमें से सिर्फ 20 का नाम पता है. And the same applies to homeopathy. कभी भी second position पे बैठ के अपने आप को evaluate मत कीजिए. The moment you do this, you are not a true researcher. So as I was mentioning to you, first you analyze and understand homeopathy as it is today. What was the need for the birth of homeopathy? And in today's life also, go around, move around, don't tell people you are studying homeopathy. लोगों से बात करो, पूछो ये होम्योपैथी की दवाएं कैसी होती हैं, ये काम करती है क्या? Gather their inputs. और जिस दिन आप इस तरह का माइंडसेट बना लेंगे, आप रिसर्चर बन चुके हैं. आपको लोगों से पूछना पड़ेगा कि तुम होम्योपैथी पे क्यों जाओगे और क्यों नहीं जाओगे, या तुम्हारा कोई एक्सपीरियंस है क्या? Ask a little child, ask an educated person. Try to talk to somebody without giving lot of intimacy और बहुत ज्यादा पहचान के बिना कहना, I don't know, मुझे ये होम्योपैथी की दवा दी, मुझे ये खा के अच्छा लगा, मुझे लगता है आपको ये लेनी चाहिए, देखो तो फायदा करेगी क्या? Move ahead in this manner and start observing everything. If you have a good observation, if you have the time to analyze what you have observed, if you have respect for your system and the right knowledge in your system, nobody can stop you. I am blessed to be a homeopath and I'm a proud homeopath. I never practice anything else. But I definitely read all practice systems of medicine and I definitely update myself on the knowledge of other systems, and also tell my students that you should know what others are doing to grow, and you should grow yourself. If you look at the global picture of homeopathy in today's times, 80 countries have made it purely legal. And there are a lot of people who are worried why it is becoming so legal. And should I tell you one thing? This is for all the students. Homeopathy is the second most most popular system of medical practice in the world. Do you know why? Thanks to the American homeopaths. They translated it into English, and the world knows English. And so homeopathy is popular. Ayurveda is much deeper, but it was never translated. Siddha is even much more deeper. So are Rigpa, the Himalayan system of medicine. It is such a fabulous system. I have read few things about it, but these were not translated, and so they did not grow. So we should be thankful. Was it only in German or any unpopular European language, we all would not have studied homeopathy or known it. So thanks to the second generation of homeopaths, Dr. J.T. Kent and others, who not only translated it into English, but also simplified its approach. How wonderful it is, the doctor is telling you how you have to move about the second prescription. Why don't you think of something else? Why is it essential that you have to follow Dr. Kent's 12 observations? Maybe Dr. So-and-so from your college can have a 13th observation. Maybe we can design an in-between potency which is much more effective. People are doing. So nobody has tied your hands. If you have the desire to contribute, if you have the desire to give back to your system, you can obviously do it. And research is the answer. Now, again, in research, I have put the same points which I had put in homeopathy. What is the age of research? The moment life came on earth, research came in. अब आप मुझे बताइए, जो जंगलों में लोग रहते हैं, वो किसी भी मोच पे अकौआ का पत्ता होता है, उसके अंदर एक थिक मिल्क होता है और बहुत गर्म तासीर उसकी होती है. यदि किसी को मोच आ जाती है और मोच का दर्द कई दिनों बाद तक नहीं जा रहा है, अकौए के पत्ते को सेक के उस पे बांध देते हैं. कौन सी रिसर्च ने सिखाया? आपकी मम्मी ने आपसे कहा बेटा हल्दी का दूध पी लो, अच्छा रहेगा. आपने अपनी माँ से रिसर्च का नाम पूछा. आपके घर वाले आपसे बोलते हैं सुबह जल्दी उठना चाहिए, आपने उसका कारण पूछा. इसका मतलब ये है कि लाइफ इज ऑल अबाउट रिसर्च. जो जो हम जानते गए वो हम दूसरों को बताते गए और वर्ड ऑफ माउथ से इंफॉर्मेशन का ट्रांसमिशन होता गया. तो रिसर्च जितनी हमारे लिए पुरानी है उतनी ही किसी भी मेडिकल सिस्टम के प्रैक्टिशनर्स के लिए पुरानी है. और रिसर्च का ट्रांसलेशन, उसका सिस्टमेटाइजेशन, उसका प्रेजेंटेशन, ये मेरी लास्ट स्लाइड में मैं आपको बताऊंगी, वही एक डिफरेंस है जिसमें होम्योपैथ्स थोड़ा वीक पड़ रहे हैं. लेकिन अगर हमारा यूथ, हमारे स्टूडेंट्स, हमारे एमडी स्कॉलर्स, हमारे पीएचडी स्कॉलर्स, द यंग एट हार्ट एंड यंग इन माइंड come up with good research, then we can anytime defeat others. I will tell you one example. In the last 6 or 7 years, a lot of researchers have started in Ayush medical systems. Because in 2014, Government of India for the first time made a department of Ayush. Earlier we were not a department, we were not a ministry. Now we are a ministry in central government. So we were a small budget, 0.5% total budget of the total health budget, and nobody liked to go into Ayush, nobody was interested in its development, but now we have an independent ministry. And the formation of the independent ministry in 2014 was the thrust of all development and research in Ayush. So actually, if we see, the right age of research in Ayush in our country is 7 years. And the birth and evolution is because our leaders are determined to give us a launch pad to prove our truth. And when they are supporting us, this is the best time to act. And the basis of this research is our principles, the existing knowledge, the formation of new principles or addition to the existing knowledge, and the need of the society. Let me give you an example. COVID-19 आया, 2019 में, 19 उसका नाम है, नवंबर में उसका दुनिया में पहला केस मिला, दिसंबर एंड में इंडिया में आ गया, फरवरी में सर्टिफाइड डिजीज हो गई, नोटिफाइबल डिजीज, मार्च में लॉकडाउन लग गया, एपिडेमिक एक्ट लागू हो गया। आज तक एपिडेमिक एक्ट उठा नहीं है। आप लोगों को एपिडेमिक एक्ट पढ़ना चाहिए। आप में से जिन्होंने नहीं पढ़ा है वो जान ही नहीं पाएंगे एपिडेमिक क्या है। अब बहुत सारा इसके ऊपर विश्लेषण हो रहा है, बहुत सारा रियलाइजेशन ऑफ फैक्ट्स एंड फिगर्स हो रहा है। तो 1918 में इसके पहले इससे भी बड़ा पैंडेमिक आया था। पैंडेमिक मीन्स जो ग्लोबल होता है, एपिडेमिक मीन्स जो एक क्षेत्र विशेष में, स्पेसिफिक रीजन में होता है, एंडेमिक मीन्स एपिडेमिक एक समय पे ही होता है, एंडेमिक मीन्स एक क्षेत्र विशेष में उसके कुछ रीजंस, इनहेरेंट रीजंस की वजह से, जैसे मार्शी एरियाज में मलेरिया इज एंडेमिक, but malaria cannot be an epidemic or a pandemic because we don't have proper conditions for growth of malaria, plasmodium globally. So what is epidemic, what is pandemic, what are the rules, acts, who governs it, etc. This you should read. 2 साल हो गए हैं। अब इसमें बड़ा आश्चर्य हुआ कि 1918 में तो इसमें बहुत ज्यादा लोग मरे थे, लेकिन ये यूरोप में रिस्ट्रिक्टेड रहा। ये पूरी दुनिया में क्यों नहीं घुमा? क्योंकि उस समय कम्यूटेशन, एयरलाइन सर्विसेज पूरी दुनिया में वेब नहीं था उनका, तो जो बीमारी जहां हुई वो वहीं रुक गई। तो अब क्या हम फ्लाइट्स और सब बंद कर दें क्या हमेशा के लिए? ऐसा पॉसिबल नहीं है, क्योंकि फ्लाइट्स की वजह से 1000 फायदे हैं। तो अब एक एनालिसिस है कि कम्यूटेशन से होने वाली डिजीजेस को रोकने के लिए एक स्ट्रैटेजी बनेगी, लेकिन हम कम्यूटेशन रोक नहीं सकते, ठीक, बट हम उसको रिस्ट्रिक्ट कर सकते हैं, हम उसको रिफाइन कर सकते हैं। सो कोविड-19 हैज गिवन एन एब्सोल्युटली न्यू पिक्चर। जो एनालिसिस हुआ है, जो प्रेजेंटेशन ऑफ केसेस हुआ है, कैन यू इमेजिन हाउ मच वर्क इज डन इन होम्योपैथी? यू विल बी शॉक्ड। 29 CTRI trials of homeopathy alone done in India. One was ours. In fact, 2 from our college. One I was the site principal investigator. So understand that if you are determined to do good work, Ayush has registered many more researches than modern medicine in COVID. And this shows that yes, people from Ayush are awakening. जाग रहे हैं, सो रहे थे पहले। पूरी दुनिया में आप देखिए, इस समय 22 कंट्रीज में होम्योपैथी इतनी एक्सट्रीमली इफेक्टिव प्रूव हुई है। Developed countries like Australia, France, Germany, of course, America, then the Middle East, then our neighboring countries, Bangladesh, India, of course. In so many countries, homeopathy has come out with a great picture. Why? Because this urge for research has developed. So now I would like to give you an insight into the types of researches which are possible in homeopathy. I hope you all know that we are having a central council for research in homeopathy. So like all medical systems, we also have one council for education and one council for research. ICMR is the Research Council of Modern Medicine. CCRH is the Research Council of Homeopathy. Now, CCRH has got a good infrastructure. The head office is in New Delhi, and they are supposed to do researches, to guide people for researches, and to motivate homeopaths across the country to take up new researches. CCRH is doing that. It has collaboration with over 30 colleges with PG courses for research. And CCRH is doing something really great. They have got a short-term studentship fellowship, STSH, which is for students, interns, undergraduates. It has got a MD dissertation scholarship. It has got a PhD scholarship. And all this shows that CCRH is motivating the desire for research in young to-be homeopaths or young homeopaths. If you look at on my screen, if you have a look, you'll see that researches can be done in many ways. The first point is fundamental and collaborative research. So fundamental is basic. आपको इंग्लिश सीखनी है, आपको ABC सीखना पड़ेगा, आपको हिंदी सीखनी है, आपको वर्णमाला सीखनी पड़ेगी। इसी तरह से आपको रिसर्च सीखनी है या करनी है, तो आपको फिजिक्स, केमिस्ट्री, बायोलॉजी की फंडामेंटल नॉलेज और एप्लीकेशन के बारे में आइडिया होना चाहिए। चलिए मैं आपको एग्जांपल देती हूँ. In one of the fundamental researches, a popular drug substance with an active substance is being used in some other medical discipline. Now we want to make a tincture from that medicine and bring it into homeopathy. First कीजिए चिरायता, already use होने लगा है अब तो चिरायता आयुर्वेद का एक बहुत पुराना प्लांट ओरिजिन का सब्सटेंस है, पेड़ है, जिसका एक्सट्रैक्ट नॉन हीलिंग फीवर्स, बहुत पुराने क्रॉनिक फीवर्स में होता है, बहुत इफेक्टिव है, बहुत अच्छी लिवर मेडिसिन है. अब उसको होम्योपैथी में हमको यूज करना है, तो हमको क्या क्या जरूरत पड़ेगी? हमको बॉटनी की जरूरत पड़ेगी, उसके सोर्स की. हमको उसके केमिकल एक्सट्रैक्शन के बाद केमिस्ट्री की जरूरत पड़ेगी. उसके केमिकल एक्सट्रैक्शन, उसके पार्ट को जिसको हम यूज करेंगे, उसके बाद हमको जरूरत पड़ेगी बायोकेमिस्ट्री की. ह्यूमन के ऊपर, लिविंग सेल के ऊपर उस केमिकल सब्सटेंस का क्या असर होगा. इस सब के बाद हमको जरूरत पड़ेगी होम्योपैथी की नॉलेज की, ड्रग प्रूविंग. हम उसकी ड्रग प्रूविंग करेंगे, और जब हम उसकी ड्रग प्रूविंग कर लेंगे और उसकी ड्रग प्रूविंग से हम एस्टैब्लिश कर देंगे कि यस दीज आर द एरियाज वेयर इट कैन बी यूज्ड, तब हम उसको अपने फार्माकोपिया में इंक्लूजन के लिए, ताकि वो बाजार में लाई जा सके, यूज की जा सके, उसके लिए जो डेजिग्नेटेड अथॉरिटी है उनको लिखेंगे. सो दिस इज फंडामेंटल रिसर्च. Fundamental researches are very important because they help in the addition of the knowledge. If you have to add new, Dr. Hahnemann had identified very few medicines. शुरुआत में मटेरिया मेडिका प्योरा से थोड़ा बढ़ा chronic diseases ने, I think 62 medicines in total. But today we have over 5,000 medicines in homeopathy globally. You will be surprised. Maximum number of new homeopathic medicines are coming from the cold European belt. France, Germany, Austria, Sweden. They are producing maximum number of new homeopathic medicines. They are developing the science. The second word is collaborative. Collaborative का मतलब होता है हम और हमारे साथ कोई और. Let me give you an example. Suppose there is some clinical condition, say psoriasis, and I want to do a study on psoriasis. But psoriasis is a known condition. It is a known skin ailment for ages. And treatment of psoriasis is also almost defined in all medical disciplines. Now, I want to put forth a research saying that the effect of homeopathy is better than other systems in psoriasis. For the saying alone will not do. I can show my cases, but that will not do. The best way is to do a collaborative research in which I will be dealing with the patient clinically. The patient will come to me. I will be dealing with the patient clinically. Day one will be baseline, nothing, no treatment. And after fixed intervals, I will be giving the homeopathic medicine. And we will be studying the clinical effect. There will be some specialist of biochemistry from some reputed organization, say AIMS, some big research institute. It can be ICMR. There are NIREH, NIRIG, Environmental Sciences का institute है. There are a lot of institutes. किसी के भी साइंटिस्ट के कोलैबोरेशन में हम करेंगे और हम उनको बोलेंगे कि हमारे पेशेंट का आप सीरम एनालिसिस कीजिए और हमारी दवा देने के बाद सीरम एनालिसिस में इस बीमारी को लेके क्या फर्क आता है उसको समझिए. वो बोलेंगे ठीक है. तो क्या हुआ? वी आर implementing our knowledge, they are implementing their knowledge. In the end, we'll come together and match our cases. What was the effect of clinical improvement on biochemical changes? And this is going to be a breakthrough. So collaborative researches करना होम्योपैथी के लिए बहुत अच्छा है. बिगिनर्स के लिए थोड़ा टफ है. बिगिनर्स के लिए तो केस टेकिंग, केस स्टडीज, देन केस सीरीज आर गुड, और धीरे धीरे वो सब में जा सकते हैं. अब ड्रग प्रूविंग, आपने देखा पेनिसिलिन को होम्योपैथी में कन्वर्ट किया गया टॉटोपैथिक मेथड से, और ऐसे बहुत सारी मेडिसिन को किया गया. नए नए नोसोड्स आए. ये कैसे आए? बिकॉज किसी सब्सटेंस की यूटिलिटी जब कहीं और प्रूव हुई तो हमने उसको अपने सिस्टम में देखा कि उसको हमारे मेथड से प्रिपेयर करके पोटेंशियलाइज करके यदि हम देते हैं तो कैसे उसको यूज कर सकते हैं. The Central Council for Research in Homeopathy has got a drug proving project, cell hai. If you ask them, they'll give you the literature. You can do it yourself. it is essential to do one drug proving in final year of BHMS. I don't know how many are doing. And all the students pursuing MD in Materia Medica should do at least two drug provings of known and unknown drugs. Because it is only then that you can actually understand how to gather the research data. Standardization means what? एक समय था जब होम्योपैथी के लिए कहा जाता था कि आर्सेनिक 30 सब कंपनीज के अलग अलग है. बात गलत भी नहीं थी, बात ठीक थी. तो फिर होम्योपैथ्स ने सोचा कि हमको इस प्रॉब्लम को खत्म करना है. तो स्टैंडर्डाइजेशन हुआ कि जो सोर्स है वहां से लेकर ड्रग के बनने तक की हर चीज को बहुत स्पेसिफाई किया, बहुत साइंटिफिकली मॉनिटर किया और लैब्स को एक्रेडिटेट किया. अब जो दवा बाजार में आती है वो स्टैंडर्डाइज्ड मेडिसिन है और उसका स्टैंडर्डाइजेशन डिफाइंड कहां पर है? मोनोग्राफ्स में. और ये मोनोग्राफ्स CCRH, HPI, होम्योपैथिक फार्माकोपिया, ये मिलके बनाते हैं. इन मोनोग्राफ्स में ये सोर्स से लेके ड्रग तक सब कुछ डिफाइन करते हैं. फॉर एग्जाम्पल, यदि मेरे घर में कोई टमेटो पैदा हो रहा है, लाइकोपर्सिकम, तो क्या मैं उससे होम्योपैथिक ड्रग बना लूं? Somebody's mic is on. Please put off your mic. Please put off your mic.
पहला तो जुआनी मीको आया था छोकरी मेरा मम्मी दूसरा तो बहुत
Somebody's mic is on. It's disturbing. So this is standardization, and standardization has brought the practice of homeopathy on another level. Now there is nobody who can question, and so much so that the Drug and Cosmetics Act is there. Then we have all the laws which regulate our manufacturing, our practice, our dispensing, and they have made our practice very, very well defined, and nobody can point out to you that yes, your drugs are not standardized or we don't follow the principles, etc. Next is clinical proving and verification. Suppose I am a physician, I am a practitioner, I can do research in the form of clinical proving. I have 10 cases which were of, say, some particular disease, diabetes mellitus, and the patient was drug dependent. And this patient, after starting homeopathic medicine, came to a reduction in the drug use. Similarly, can be with hypothyroidism, where even you can get patients who are stopping their drugs. Even with hypertension, you can do this. Isko darwaze ko band karna. Okay. So clinical provings can be specific clinical conditions on which you can do your work. It can be retrospective, that is backwards. It can be prospective, forwards. So if you do forwards or prospective study, you have to define everything. And after you do it, it can be verified as well. So verification can be done at many levels. जो पहले से known है चीजें, पता है कि Barberus vulgaris का use kidney stones में देखा गया है. तो ये तो इतिहास में लिखा है, किताबों में लिखा है. आप अपनी क्लिनिकल प्रैक्टिस से उसको वेरीफाई कर दीजिए, 10 केसेस में यूज करके वेरीफाई कर दीजिए. ये रिसर्च है. तो रिसर्च हर वो चीज है जिसमें आपने एक एनालिटिकल माइंड यूज किया है, जिसमें आपने करंट सिचुएशन को एक एक्सप्लेनेशन दिया है, which is worth pondering, which is scientific. Okay, but how you have to document it is also very important. Now there are surveys. Surveys are done on population, on large number of people. So survey is on a very big population. Say for example, CCRH took up a Calcarea FOSS program for outreach program for small children. There was a program for mother and child. These were large programs and the data was used as survey. Another area where research is possible is collection and cultivation of medical plants. We can assess that when the plants are grown in particular climate, particular conditions, with so and so kind of seeds and manure, etc., they are coming up with better production of medicinal substance. There can be public health programs. Public health programs, there is an NPCDCS program for prevention and control of diabetes, stroke, cardiovascular diseases. So even your institute can have its own public health program. You know what is the disease in your area. Say, for example, asthma. So now your institute can launch a public health program on asthma. You can have your professors coming together. They can do a write-up. To start the program, you can have a small pilot study on a small number of people, evaluate its result, talk to some seniors, experts, how to improve the study structure, and then implement it on the population. So these are all the different ways in which we can do research. And now comes the epidemic research, very important. You all must have heard of arsenic album as the genus epidemicus. So in epidemic research, we are basically concentrating on first the preventive aspect and then the treatment part, management part. So genus epidemicus, we know in homeopathy, is a collection of symptoms of people presenting with a same infection or condition and in which a larger similarity can be seen. And we come up with the genus epidemicus, that is the preventive. Genus epidemicus can change with place, with climate, with symptom presentation, etc. So epidemic research is another important segment of research. Now I'm coming to my last slide, and I expect you all to be very, very attentive and very, very particular when listening to this. We have to create perspectives. Everything is in our hands. Every case which comes to homeopathy, whether it is a case of an acute presentation, cough, cold, coryza, or it is bad effects of chemotherapy in cancer, or it is a post-surgical complication unattended, every case is a research in itself. So to have a good research aptitude and ability to convert your work into research, first you should have a very good system of collection of data. Okay, so for that system of collection of data, if you can afford, you can make it computerized. If you cannot afford, you should have a very good case taking format and case presentation format. In this case taking format, the detailing of every aspect of the case has to be done. Maybe after 6 months or 12 months, you'll be able to realize that I have a record of 25 cases of this type, and you can publish your 25 cases. So to understand this, first you start reading research literature in homeopathy. For that, you should know that the Central Council for Research in Homeopathy is publishing the IJRH, International Indian Journal for Research in Homeopathy. There are over 70 journals of homeopathy which are published. Thine Publications has got a good number of homeopathic researchers. A journal is called Homeopathic Links. A journal is called Homeopathy, which was earlier called British Medical Journal. Now, there is Journal of High Dilution Medicine. There is International Journal of Integrative Medicine. There is International Journal of Integrative and Complementary Medicine. And there are some of biochemical researches. Everywhere homeopathy fits in. So first you identify your work, you give it a proper shape, you write a proper research paper. For that you read a lot of research papers and you bring out something which is new, which is an observation, which is a promise, a challenge to medical science. And then you will be able to perform better. So anybody who has to do research or who's willing to do it should be an innovative mind. You have to innovate. You have to create. Why did a simple viral infection become a pandemic? Because the virus was innovating. The virus was mutating. So understand, for anything to exist and grow, you have to have innovation. Homeopathy has endless scope because our materia medica is unexhaustible. You can add new things to it. And remember one thing, you have to learn the modern practices, use of equipment, use of current modern machinery, how the practices are done, what does the patient undergo in what kind of surgery. And you have to apply your medicines in those situations because they were not present in Dr. Hahnemann's time. There was no mobile in Dr. Hahnemann's time. So how can you have bad effects of continuous use of mobile in your repertory or in your materia medica? But a lot of people are innovating and innovating. And remember to use standard literature. I want to warn all the students who are using homeopathic softwares alone. There is no software which is complete enough to lead you to cases. You have to use your books. So your book should be your final resort. So if you have the idea of application of existing knowledge, creating something new, knowing what is existing, and the desire to sum up all your work into a publication, and such a publication which people can read, not only from homeopathy, also from other faculties. I'll give you an example. On my ResearchGate platform, 3 days back, I uploaded a study on malaria. We have done a prophylactic program with State Government of Madhya Pradesh, Department of Ayush and Department of Health. It is kind of a collaborative research. We gave the preventive for malaria in the malaria endemic areas to 23 lakh people for 4 years. And the health department assessed the occurrence of malaria, and they have given very good results. So we have published it from the Madhya Pradesh government. I have uploaded it. It has got a DOI number. It has been uploaded on the ResearchGate. Please go through it. There is an older article which was published in International Journal of Epidemiology. There is another article which is on which was published by Homeopathy Links on immunomodulation in COVID, and a lot more in the pipeline. So you may please go through it and many, many more articles, and you can understand what you can contribute as a researcher. And to be a researcher, you have to have constant updation of yourself in every way, in terms of knowledge, in terms of practice. There was a time when I was told by my teachers that we should give the exact simillimum. But when I came into practice, I realized that simillimum is different for every homeopath because he's an individual. So I designed my own way of practice. I designed the most similar should be the best medicine, and other similars should be studied so that in the second prescription, I can do more justice to my patient. Sometimes it happens that we get a lock in the case. The case becomes arrested. No progress. Na बढ़ रहा है, na घट रहा है. This is a point of research. ऐसा क्यों हो रहा है? What is the cause which is, or what is the factor which is not leading to the completion of the case? This is research. You can write a beautiful paper on this, on a difficult case which suddenly got jagged. And then you could find the solution, maybe by some seniors helping you out, your teachers, your consultants, and how you came out of the case. So there is endless scope of research. Prospective for homeopathy is endless. The desire is missing. इच्छा शक्ति की कमी है. क्यों ना तुम सब एक एक रिसर्च पेपर आज ही से लिखना शुरू करो. ठीक है, नहीं छपेंगे, कम से कम अपनी क्लास में पढ़ के सुनाओ, एक दूसरे से बात करो, और वो विषय ऐसा होना चाहिए, टॉपिक ऐसा होना चाहिए, उसका रेप्लिकेशन नहीं होना चाहिए, रिपीटिशन नहीं होना चाहिए. जब इस तरह का माइंडसेट होगा तो धीरे धीरे आप रिसर्च मेथोडोलॉजी सीख जाएंगे. रिसर्च मेथोडोलॉजी इज अ साइंस. रिसर्चेस इतने तरह की होती हैं, ऑब्जर्वेशनल, एक्सपेरिमेंटल. ऑब्जर्वेशनल में कोहोर्ट स्टडीज, केस कंट्रोल स्टडीज एंड क्रॉस सेक्शनल स्टडीज. एक्सपेरिमेंटल स्टडीज कौन सी होती हैं? जिसमें आप कुछ नया देख के कुछ नया ढूंढने की कोशिश करते हो. ये सब आप सीख जाएंगे. जब आप पहले से रिसर्च करते आएंगे तो आपको अपनी रिसर्च को सिर्फ उस फ्रेम में पुट करना है. फिर आता है उसका एनालिसिस वाला पार्ट, जो स्टैटिस्टिकल है, वो बायोस्टैटिस्टिक्स कहलाता है, लिविंग बींग्स का. उसके लिए अगर आप पीजी कर रहे हैं तो आपका सब्जेक्ट है, आपको पढ़ाया जाएगा. अगर आपको नहीं पढ़ाया जाता है, आप हायर कर लीजिए कोई बायोस्टैटिस्टिशियन. आपके पेपर में आपका सारा वर्क रेडी होगा, बायोस्टैटिस्टिशियन आपको उसका एनालिसिस करके दे देगा. कुछ भी कठिन नहीं है. So if you have a will, a desire to contribute to homeopathy, then there is no limit. And my simple urge and request from all the students is that don't stay in homeopathy because there was no other choice. Love it, and then you see it will love you. It is one of the best methods of medical practice. A system which communicates with every individual, mentally, physically. A system which limits the bad effects. A system which teaches you to come close to nature, to help your body to heal. It is your innovation, your likeliness, your positivity which will take you further. I think that was enough for today. If there are any questions anybody wants to pose, I am open to them.
Thank you, ma'am. Ma'am, few questions are asked by the students and the staff.
Yeah.
First topic is which are the current suggested topics that can be thought of for the research?
Okay. See, in the current scenario, I would suggest that researches on improving the immunity of the individual. And how will you judge? The method of judgment should be, you have to take a cluster of people who fall sick very soon, who are always taking infections, who are again and again coming down with fever or any other presentation. And then you have to, your subject should be such that we are trying to modulate the immune mechanism in people who have a weak immune system. And the individual case has to be taken, medicine has to be individualized, and you have to analyze it from time to time. Other areas of great interest can be in females, PCOS, polycystic ovarian syndrome, acne vulgaris in both males and females, troubles of hair, GIT disorders, very common, आने वाला युग, gastritis, Crohn's disease, inflammatory bowel syndrome का युग है, क्योंकि सब लोग बाजार का खा रहे हैं, सब लोग सॉसेस, जैम्स, बाजार की चीजें खा रहे हैं, सबको ये प्रॉब्लम होने वाली है, आप गट पे काम कीजिए, अनफेलिंग. Then there can be a lot of work which can be done on children. Lot of work can be done in the geriatric age group, क्योंकि ये वो एरिया, बच्चों में कोई दवा देना नहीं चाहता अंग्रेजी, बुजुर्गों में दवा देने का मतलब नहीं, उन बेचारों की ऑलरेडी ड्रग डिपेंडेंस होती है और वाइटलिटी लो हो जाती है. सो यू हैव टू एक्चुअली, होम्योपैथी कैन फिट इन एवरीवेयर. आप अपना इंटरेस्ट भी देखिए कि आप खुद क्या किसी पर्टिकुलर चीज को, किसी पर्टिकुलर आपके पास ज्यादा पेशेंट्स किसी चीज के आते हैं, ठीक है. और होम्योपैथी के लिए अगर आपको रिसर्च करना है तो आप होम्योपैथी की मोड ऑफ प्रैक्टिस के ऊपर काम कीजिए. क्या हम हर पेशेंट को, कि हम कैसे एड्रेस करेंगे पेशेंट को. अगर आपको अपने स्टूडेंट को सिखाना है कि तुम्हारे पास क्लिनिक में एक पेशेंट आया और उसने ये प्रेजेंट किया, तो व्हाट आर द टूल्स व्हिच यू शुड हैव, व्हिच शुड बी रेडी. So try to contribute to homeopathy also. That would be my suggestion. Yeah.
Yes, ma'am. One another question.
Yeah.
What are the current projects that are going on in Ayush to conduct the studies and which can be thought of?
Okay. For this, I would suggest that you please visit the Central Council for Research in Homeopathy website. Okay. Once you visit the Central Council for Research in Homeopathy website, you will be able to see what all is going on right now. So the Ministry of Ayush last year transferred all the funds for researches in COVID. This year it is not so, but last year it was done because a pandemic had broken up, and so they had transferred all the funds to COVID. But normally we have got a lot of headings. There are types of researches. One is the intramural research, in which the people of CCRH only do it. There are different centers. And one is the extramural research. So in the extramural research, we all can apply to the Central Council, and they have different projects. Earlier, they used to take a theme for every year. Once it was mental health, once it was neuromuscular disorders, once it was allergies. So they take a theme for every year and they invite applications in extramural research. So you have to keep visiting the website very regularly. Secondly, there can be collaborative researches. For institutions, I suggest collaborative researches. Like you will be doing the implementation part and the technical guidance will be given by Central Council. Suppose you are collaborating with me. Okay, we both are, your college and your university and my college is collaborating. We can definitely collaborate. We can give you technical guidance on certain issues. You can do it this way, that medicinal part and fund, and some very little fund is taken up by the institutions. Like ours is an autonomous institution. So if the whole fund of your study is say 2 lakh rupees, 5% is taken up by the collaborative institution to facilitate things. Then you can have IEC programs, information education programs, continued medical education programs in that. A lot of things can be done. So government has got a whole scheme of things which can be implemented. The idea is readiness to do. We can start with a very small study on 20 patients. You do it, you start it, I am with you. So start it on 20 patients, make a good program, write it, allocate a little budget to it. Not much is required. You people are paid, I am paid. But yes, for few things we will have to spend some money. If there is any transportation, if there is any expert lecture, then you will have to pay. But otherwise, it can be easily facilitated. Like we did with NIH. In NIH, I was one of their consultants, and we did a study on COVID in Tamil Nadu. There is a hospital which has got homeopathic doctors as their medical officers. So we did a COVID study in Tamil Nadu also. So that was a collaborative study. So you can come up with a lot of things. If you feel that technical guidance you need, it can be availed. There's no problem in that.
Last question. That is, which mindset is required from the side of the institute, and which mindset is required from the side of the institute and from the side of the student for the research, for making the research better and to progress in the field of
very
research?
nice, very nice. See, I'll tell you, first thing is that if an institute is keen to do something on research, they should have regular updation program. You will need at least 10 to 20 lectures and updations from people who are experts in this for your institute. So if the institute is willing, they should make a research department first thing. Okay, among your faculty only 2 or 3 people can be given the task of taking additional care of the research department, like I am doing. Okay, so research department is going to do continuous CMEs. Research department is going to update the students. Then you should have tie-ups. Maybe in your city you have some good research institute. You can have tie-up with them. They will come and deliver a lecture for your students, or you can write a small research project with somebody. So for an institute to come up into research, they will have to identify 2-3 people who will do the task. They will have to allocate a small budget initially. Later on, their studies can be funded by Government of India. Government of India has a lot of money for research. Initially, 2 lakh rupees in total is more than enough for a year or even more to organize 3-4 major events. And these are not big amounts. Actually, the outcomes are very good. See, if your institute has got 10 international publications in 1 year, then nobody can stop you from getting an accreditation or from getting post-graduation. I mean, I'm into all this, so I can tell you, I'm doing PhD. So for an institute to get PhD, it should have this many number of published papers. It should have taken up this many researches. So this is what is required. So if your institute really wants to grow, then you should identify people. You should use your interns. They are a very good capacity of human power. They can be used. They can be trained. You can send them to our institute for training. We can have a tie-up. We can train them here if you bear the expense of their staying and everything. So things can work out in that way. And small research projects can be taken up immediately. There is no problem at all.
Thank you so much, ma'am, for this wonderful lecture and throwing the light on the things, small things which we can never thought of. Thank you so much.
Thank you so much. It was a pleasure for me. Thank you.
Thank you, Dr. Juhi. Thank you so much.
Thank you, ma'am. Thanks a lot.
Ma'am, sorry, ma'am. A question again. That is, a student has asked that which books, magazines, journals should we read about the research in homeopathy?
Okay, so first you start with IJRH, Indian Journal for Research in Homeopathy. It is a free of cost journal. It is online totally. You read it. Okay, then there are few good homeopathic institutes in India who are coming up with journals. Like JIMS Hyderabad has its journal. Dhavle Institute has its journal. So you can go through it. Besides this, you have to, but I think that they will need some training. You have to train yourself into search engines and searching methodologies of research on the internet. Because normally students do it themselves, then they'll end up into wrong sites and non-standard data. This is what we don't want. So let them start with IJRH. Indian Journal for Research in Homeopathy, and read the current issue again and again, understand what has to be done, and then they can go ahead. It is endless.
Okay, ma'am.
Okay,
Thank
okay.
you so much.
Thank you. Thank you so much.